Before I start this video, I would like to send a special thank you to all of the people that have helped support through GoFundMe. Thank you all very much for your support. We really, really appreciate it. We can't thank you enough.
I was about to say, she hasn't been wanting to eat as much. I've been trying to, kind of feed her, we talked about everything yesterday. And she'll take some, but then she really just kind of becomes defiant and, throws her head down and starts turning away a lot. And I'm just like...
So the last time we had the camera on, we were at the vet. That was last night. We were trying to feed Khloe because, they said that she wouldn't eat, and I knew she'd eat, but she needed to be hand-fed because of the way her mouth is working. It's not working properly. Her brain's not firing to where she can eat food on her own, so she has to be held and hand-fed, and her jaw has to be held just right, and she can totally get food down. So we did that yesterday, and after that went on, we found out that, the amount of money that we put down, the $1,000, was going to be up this morning, and we were expecting to go out there and, get the dog this morning, get Khloe this morning. But my wife had a phone call at 5 o'clock this morning, which I'll let her tell you guys about that.
I called in after doing research on Khloe's symptoms and finding out that the parts of the brain that we've been told are swollen and causing the neurological symptoms, the cerebellum and the brainstem, can be affected by neurotoxicity from one of the medications that she was on. At the very beginning of all this, she was put on a medication for another infection, and it's called Metronidazole, and basically it can create the neurotoxicity and cause the symptoms that she's having. There have been lots of studies on this, and they use diazepam to help reverse the symptoms. Basically, if it's that medication, all of the neurological symptoms that she's having can be reversed, and it will happen just by stopping the medication, but it can take a couple of weeks.
Explain to them where we got the medication, when the medication come into play.
So the medication came into play after the first vet had said that he didn't recognize the limp in Khloe, and after she had bit her tongue. And when she started taking that medication was the severe onset. She had a limp before, but once she started taking that medication, her gait became unsteady. She wouldn't navigate stairs. She wouldn't jump up on beds. And that was the very beginning of the rapid decline of, her gait and the way she was walking.
Yeah, I definitely thought that she was getting messed up by this pill, but I thought it was just making her high. I didn't realize that it was doing something negative to her. But I definitely noticed a difference when she started taking that pill in how much movement she would go throughout the day and stuff like that.
There were several studies online where multiple dogs were researched, and every single one of them that was given diazepam, which is basically Valium, the reversal of the neurological symptoms starts to happen in a matter of hours, long-term 3 days, whereas just ceasing the medication that she's been on, which she was off since Friday, that can take a couple of weeks. So at the check-in this morning, I talked to the vet that was on staff at the hospital.
They called you at what time?
Well, no, I called them originally at 2 a.m. and explained to the nurse, because I said, I know I'm not supposed to check in right now, but hey, I'd like to potentially talk to the doctor about this in the morning, get her started on an IV drip of this. And then I did my 5 a.m. check-in.
Hold on, stop for a second. Explain the research. Explain how you came upon what you blew through explaining.
So I started researching the parts of the brain that were affected and the ataxia, the not being able to walk. In both the areas of the brain that we were told that are affected in Khloe, it stated that this medication could cause neurotoxicity affecting those two parts of the brain. So then I started researching that medication and neurotoxicity and found clinical studies showing that this diazepam could reverse these symptoms. And I mean, the symptoms, are very similar to the other things that it could be, which are, parasitic infection, fungus,
Stroke.
any of these other things. But it's if you give the patient, the dog, diazepam, you'll know very shortly. And are the blood tests that we requested to be done to make the determination on the other things, they won't be ready until not tomorrow, but the Monday after. So my thought was, diazepam, you guys wanted to put her under general anesthesia for an MRI.
So you guys, the vet.
The vet wanted to put her under general anesthesia for the MRI and the spinal tap. Obviously we don't have the funds for that yet, but let's try this IV drip and then get her on, the oral diazepam and see if it reverses it. We'll know very quickly.
That's what you talked to the vet about this morning.
Yes.
That's what and now tells them the response.
He basically called me a layman and asked me what my clinical background was. I explained that my uncle has been in the neurological field in Jacksonville for a long time, and basically I've been in and around and done research on clinical studies in my work, and that didn't matter. He called me a layman and told me that it was absolutely ridiculous that diazepam could not possibly. He knew what the neurotoxicity was from this medication, and he's heard of that and he's aware of it, but diazepam makes absolutely no sense to him. And I started to discuss the reasons why, and the parts of the GABA transmitters in the brain that both medications interact with. And he again was like, I'm going to say this in the nicest way I can. You're a layman and you just need to, go with the medical treatment plan that we came up with, which they tried pushing us into,
tests or nothing.
The most expensive test that we couldn't afford, or, potentially euthanizing our dog rather than doing any blood work, any urinalysis, anything to begin with. It was a huge push to try to get us to do the most expensive things first, rather than using other tests that are available.
Even acting like I was unwilling to pay. Not that I didn't have the money, but I was just unwilling to fork it over. I mean, yeah, it was pretty blatant.
And so, when we were there the first day at this vet hospital, after we were given the option of the cost of bringing the neurologist in after hours, I said, look, she's lost a ton of weight. She hasn't been drinking or eating. She's obviously dehydrated. Can't dehydration cause, neurological symptoms as well? She said, yes. I said, okay, well, if it's your pet and you don't have the money at the moment to do these other, the MRI and the spinal tap, how do you feel about a broad spectrum antibiotic and a steroid to take down the swelling in the brain? And she said, and then giving her IV fluids to help replenish her.
Her response was, well, sometimes when we can't afford to do the test, then we just, throw stuff at it to see what sticks. It's a common practice in both human medicine and animal medicine, acting like, why are we the ones that had to suggest it? But anyways, go ahead.
So she him-hawed around about that, and eventually she agreed that would, be an all right treatment plan to sustain her until we could figure out if we were going to be able to do the MRI or not. But this other doctor that was on call last night, acted like it was their idea to come up with that treatment plan, and, we just needed to stick with that and listen to them and trust them. So So again, the doctor said that we just needed to trust them and their plan of care, which wasn't their plan of care because they wanted to go straight into the most expensive test without doing anything else to check on.
To be fair, it was a brain picking and her research and understanding of what was going on that led to the plan of care and asking questions of the veterinarian. It's not like Tony just pulled out her prescription pad and said, here's what I need you to do.
But they were pushing for the most expensive test and not really wanting to do anything else that, was possibly
an inexpensive fix that just might make her clear up, that's not going to harm her to spitball it and see if it works.
And with this morning, when I mentioned the diazepam, and he was saying there's no way that could possibly work, I was very exhausted at the time, and he said, we're going to be calling you in a little while as well because you depleted your deposit of the first $1,000, and we'll give you a plan of care. And if that doesn't work with you, we'll give you another plan of care until we get to one that you're willing to do. And so I waited, and they called at 7 a.m. In the meantime, I was reading the case studies again. Called, they asked for another $850, and said we were looking at anywhere between $600 and $1,000 for today till tomorrow. So in the meantime, I called my uncle this afternoon, and like I mentioned before, he's been in neurology in Jacksonville for years. And I talked to him about, all the case studies that I read, and he said that makes perfect sense, and went into all the reasons why. And he recommended, that we potentially change vets to someone that is willing to work with us and read the studies and, at least give us a good educated reason as to why they're not willing to try something that my uncle says is, safer than the amount of Benadryl that it takes the dog to feel the effects like a human does. He's like, the Valium is, it's extremely safe. And yeah, I think it'd be something good to be able to test to see if she did have neurotoxicity due to it. So where we're at right now is I've printed out all the case studies. Khloe is actually on another medication via IV right now because one of the meds that she was on last week could create ulcerations in her stomach and GI tract with the steroid that she was put on. And so she needs to be on that IV probably until tomorrow morning. So we made a call to our animal hospital out by us, and also to the emergency vet out by us that was very informative when we took Khloe in the other night before we went through, working our way to the neurologist. That particular veterinary clinic stated that they were familiar with metronidazole neurotoxicity, and that they've had cases where they've used diazepam to reverse those effects in a faster way, and that they would be willing to definitely consider that. They couldn't guarantee anything until we got her there. And so they said they'd be more than happy for us to bring her in tonight. Although the doctor that has that experience, maybe the other one does as well, but the doctor that was on when I called, she leaves in about an hour. So
I don't think that matters much because it's putting, the medication in a IV drip and putting the IV drip on a dog. One doctor can do it, another doctor can do it. It's pretty simple stuff.
Right. And with the way the dealings have been with this clinic out here and the long drives to get to Khloe back and forth each day, we're feeling like we'd be rather have her close to us, and then if we end up raising the money for the MRI and the spinal tap, then we can take her back out to this facility to do that.
At one point when they talked to her, they were talking about how after the testing and then the treatment, we should be prepared to pay around $10,000. They say these things like it's no big deal, and they also put you in a position to feel like you have to do that, or you feel like a bad person that doesn't care about your animal. Like, it's literally, it doesn't have anything to do with the fact that could, put somebody homeless if they aren't able to pay their credit bills on time or anything like that. It has nothing to do with anything in these people's minds while this stuff is going on. It's just crazy to me that they want these amounts for these tests that just seem obscene. It seems obscene to be paying that amount for that test. And
the emergency vet we saw that was so informative the other night, he was like, make sure they do the white blood cell count, make sure that they run these other tests for tick-borne disease, and they need to spin it. And he was going into all the details of what they needed to do, never mentioned MRI or spinal tap as the only way to determine what's going on with Khloe. You know, from what I understand, the MRI is going to show us if there are lesions in those parts of the brain and where exactly they're located. The spinal tap, if there's a parasite or there's something like that, you know, that can be very informative if the blood tests come back negative, but it's not, you know, the first line of diagnostics that they should be using on a pet. So we're just more comfortable. We think we're going to give them a shot and see if...
Well, I've always wondered about the toxicity panel. Like, did she chew on a root of a plant that I've been digging up in the backyard while I've been doing the gardening that might be toxic? You know, for all I know, the grandmother had a flower in the backyard that might be toxic to dogs. I don't know. I know this, that she was so allergic to all animals that she would not ever have a concern about putting a plant in her yard that's toxic to animals because she never plans on having any animals. So it's insane to me that they haven't done any of the more easy tests, like, you know, a urinalysis or a tox screen.
Well, the one neurological panel that they're doing, and one of the things that happened yesterday is I was like, look, you know, I keep asking about cryptococcus, which is a fungus, and I keep asking about Ehrlichia, or Ehrlichia, I don't know. Anyway, it's one of the tick-borne diseases that seem to encompass all of her neurological symptoms, and that first vet had mentioned that his first thoughts were tick-borne illness or a fungus, and those are the two that match. So I wanted to make sure that those were on there, and I brought those two up to her again yesterday because the other doctor that was on call in the middle of the night wouldn't respond to me as to whether they were testing for that or not. And so I asked her when we went to visit Khloe yesterday, and she's like, well, you know, like I told you yesterday. And I'm like, oh, what, the MRI and the spinal tap? And she just kind of smirked at me. And I said, so the neurological panel, you know, is there any way to see what all is included on that? And she's like, oh, well, that's not a bad idea. And then she goes out and comes back in and reads off the list, and both of those things are on there. But again, you know, her initial response is MRI and spinal tap. You know, it's like They don't want to do any other diagnostics other than that. They want to see where it's located first and then determine what the cause is. But it is not logical, and it's not cost effective, and it's not like we don't want to help her. But at the same time, they're acting like she couldn't eat. You know,
they're acting like she had no ability to eat. She's wasting away until we get there. And then I feed her a can and a half of food yesterday. And after I feed her a can and a half of food, then this morning when she's talking to her, they were acting like, oh, well, you know, she's seeming a little bit better now.
We were able to get her
she's hydrated and has some food in her. And if this is a bad reaction to that other medication that some frickin' Valium can take care of, then we need to feed my dog some frickin' Valium.
And why are you not willing to even try it?
That's insane to me. They're not willing to try it because it doesn't cost $3,000. And
they don't want it to resolve.
At this point, they convinced my wife they'd put another $800 on her credit card, which, being that, you know, nobody has real solid, great income coming in at the moment, which I'm obviously going to start selling a whole bunch of my stuff. So keep your eye out for sales coming soon. We've had it to where we were way overextended in credit and weren't able to pay it. And we don't ever want to be in that scenario again. It doesn't feel good to have creditors coming after you. And that's not a scenario we're trying to be in. We've also been homeless before, and that's not a scenario we're trying to be in. And the fact that the house that we live in now is taken over because my father-in-law had a stroke some months back. I got to remember to grab the camera when we're going around a corner.
There's going to be a few of them now because
we're about done. So, anyways, we're heading back into the
hospital
vet's office right now. The hospital. Yeah, we're going to be there in just a minute, and we're going to see Khloe. And my wife brought a bunch of her research on the Valium and the toxicity of the medication that vet number 2 had prescribed for inflammation. And if he doesn't want to accept that, then we're definitely leaving with my dog tonight, and we're going to check her in at the other hospital in Destin, where they will continue with the IV that she needs so that she doesn't get stomach ulcerations. And then if we do end up needing an MRI or a spinal tap or any of that stuff, then, we'll come back out when that happens. If they are on the page of, maybe that they'll go ahead and try it, because, why would you try something that might work? Then she'll probably stay out here tonight, and we'll just feed her and hang out with her for a little while. But we'll see all that here in a second.
Yeah,
That's part of it too.
She's
Drooling as well.
This didn't start until those pills.
Yeah.
Like the heavy, hardcore drool like this. This did not start until those pills.
Someone grab something. I need to wash my sleeve. Poor baby.
You want to cuddle?
Are you hungry? Are you hungry?
Yeah.
You're feeling somewhat better, aren't you? It is that medication. Your mama figured it out, didn't she? She figured out the biggest issue, huh? It is that stupid medication, isn't it? Is that what's going on? Oh, my pretty girl. Is that what's going on?
Poor thing.
Grab me a couple tongue depressors. Are you hungry? They sit back and that's not nothing. That's fucking lie, isn't it?
Are you hungry?
That's not true.
She's like, what you got?
Poor thing. Yeah, it's like
Do you want to grab the paper towels behind
We're
you?
gonna get a bunch of them.
Yeah, and there's
There's a
only
roll.
a few.
Like, you should. Somebody should go get a roll from.
the car.
Yeah, look at you. You don't want this, do you? This stuff smells horrible, doesn't it?
Look at her tongue. Her tongue is working better.
She's like, give it.
Other than the slobber.
We're gonna have more of these. Maybe.
Oh.
Nice job,
Go
Chloe
get some paper towels. Be careful.
Nice
you
job. Look at you drooling there, trying to
Me.
turn your nose up at it, like.
Disgusting. Where the
Look at her. She wants it bad.
We can't afford another $800 bill because we leave her overnight, and so
Yeah,
we have
what
to have a
time do they-
conversation with her about money. Yeah, you turned it to us. You didn't want it.
She's
Let
not
her try to
hungry.
get it. No, she wants it.
She's trying. Such work. I know your tongue doesn't want to work right. Daddy, help you here. You gotta let me do it though. Open up. You gotta open up a little bit, and then there you go, just like that.
She wants to do it on her own.
She does want to do it on her own. You're right. I wanted to get all of the initial contact with the dog and stuff on camera, but I missed all of that because of her attitude with the camera initially. She didn't want to be on camera. She didn't want to be a star. And I don't think that's it at all.
The conversation is
It's under kind of dirty business practice. You were hungry while we were gone, were you? You think this stuff smells like shit, huh? Horrible food. You don't like this. You want the filet mignon steak you eat every night at home. Or steak and lobster dinners you're used to.
Yeah, look at that tongue. She couldn't do that before. See what she's doing?
She's getting better.
Slowly but surely.
You see that? Can you tell the difference? You've been here.
Well,
every
not
day.
being given those pills for a number of days is a huge effect. It's starting to work its way out of her now that she's got the IVs in her and she's starting to pee and stuff.
Right.
And then, all the dogs in those studies, they were on antibiotics, a steroid, and IV fluids too.
Yeah.
Like they tell you to do that too.
Well, just in case, because you can't afford the MRI, but you can afford all the medication.
Mm-hmm.
I can afford every piece of medication, but I can't afford the tests. Like,
Well, not both, and it's like if you're gonna
Well, the medication doesn't cost $3,000.
being here getting the IVs, doing all that, like, yeah.
Still.
Like I'd rather treat as much as possible rather than try to see
Right now,
where
yeah.
the lesion is in her brain.
Me too.
But her tongue is working better.
And she likes this brand.
That's why I bought so many cans.
It was the day before we took her was the first time she got soft food. And she could swallow it when I was spoon feeding it to her better than when we got home and I gave her those pills and then I tried to feed her after the pill had
It
been
was
in there.
easier to do this
It wasn't
yesterday.
the same, like her tongue wasn't working the same that fast.
'Cause
It was-
I'm proud of your tongue movement.
But it's really gross.
She doesn't care how gross it is, she's liking that.
her stomach's been empty all day.
But her being able to even do those little,
There's no way these nurses are going to spend 20 to 30 minutes to hand feed the fucking dogs. It's not gonna happen.
well, he told
Can I
me
do it at some
that
point?
she was eating on his shift. He said she's eating, she went out and,
She can't fucking eat.
potty, what's that?
She can't fucking eat unless they.
He said via hand feeding, and he said it took two of them to take her out to go to the bathroom, but she went and did it. And she's talking about letting her
Look,
pee in
didn't mean
the-
to press it that time.
Kennel. Well, yeah, I mean,
Which?
the dogs they'll definitely pee in their kennel because they get left too long.
There's also raining a lot over here today.
She wouldn't go outside if it was
Uh-huh.
raining. That was a gross sound, though, Chloe.
She's leaving stuff behind. Wow.
The one that doesn't want to go down. You can stop this recording her eating up close. I wanted to get some of the interaction and stuff, but.
Oh.
Are you all done?
Sad
you done? You want a break?
Khloe.
Are you all done? You don't want no more? You full? You full? You sure you're full? You done? You all done?
Her tail. Her tail.
Stop
You
for
want
now.
more? You want more? Pitter pat, pitter pat,
You want
pitter
some
pat.
water? She's got a piece on her own.
Hey, yeah.
Hey, how are you?
Good. How's it going in there?
We should just like flip you around when I try to
Her
close
tongue
it
seems
out.
to be functioning better than yesterday.
I was about to say she hasn't been wanting to eat as much. I've been trying to kind of feed her we talked about and everything
Right, yeah.
yesterday, and she'll take some, but then she really just kind of becomes defiant and throws her head down and starts turning away a lot. And I'm just like, yeah, I'm trying.
Yeah, she'll take some, but then she really just kind of becomes defiant and throws her head down and starts turning away a lot. I'm just like,
Well, do you guys want a few more minutes to visit with her and everything, or are you guys ready?
Yeah, we drove.
We
from
drive
Bedford.
2.5 hours to get here, and then we have to drive 2.5 hours back. So it's 15 hours of driving in 3 days just to see the dog.
Fair enough. All right, well, I'll give you guys some more time, okay?
Alright.
And then we'll bring her back in just a little bit.
So we're not taking her. We are. Pretty sure we're taking her home.
Oh, it's not what he said.
That's okay. That's what I'm on.